At the beginning, you will see the treatment of the sacroiliac, sacrotuberous, and sacrospinous ligaments. Next, we will proceed to treat trigger points, the gluteus muscles. Finally, we'll do joint mobilizations of the sacroiliac joints. Let's start. We can work on the ligamentous area found in the gluteus and pelvis to indirectly address the sciatic nerve. We know that there are ligaments like the sacroiliac, sacrotuberous, and sacrospinous where there are openings for the sciatic nerve. By acting on the bony parts of the pelvis, we can indirectly act on these ligaments, aiming to give dynamism to the ligament and thus try to reduce the pain. Pressure that can form on an inflamed sciatic nerve. First, we must identify where to act. We know that the sacroiliac ligament, which is the main part of the lateral side of the sacrum, extends toward the ischial tuberosity, which is located right down here. This is the tension zone of the sacrum. What do we do? First, we find the posterior superior iliac spine, a key reference point, and we know that laterally is the lateral side of the sacrum. Here we have the ischial tuberosity, and we know that in this space the sacroiliac ligaments are present. We can do this kind of work. So we place one hand at the ligament's origin and the other at the distal insertion. At this point, we apply downward pressure and move our hands apart, remembering to place our weight directly on the area being treated for comfort and effectiveness. At this moment, I push and pull my hands apart. I can also maintain the pressure for a few seconds and gradually release. Once more, I push and pull my hands apart. This action is aimed at the sacroiliac ligaments and positively affects the sciatic nerve because of its close relationship with the sciatic nerve, making it an effective treatment for sciatica. Now, we discuss the anatomy and trigger points of the gluteus medius and minimus. Why treat these trigger points? These trigger points can frequently cause symptoms similar to sciatica. True sciatica is often confused with that generated by trigger points. Obviously, in cases of sciatica generated by trigger points in the gluteus medius, minimus, and piriformis, the symptoms of neuropathy are not present. Therefore, if the sciatica is due to trigger points, we do not have reflex alterations, for example, nor loss of strength, nor changes in feeling. We only have the typical pain radiation, which can be easily identified through trigger points. To locate these muscles, we first identify the iliac crest. We know this is the patient's iliac crest, and we also know that the gluteus medius originates from the iliac crest and inserts into the greater trochanter, while the gluteus minimus originates slightly lower than the gluteus medius, a bit deeper in the posterior iliac fossa. It inserts into the greater trochanter as well. Once we have identified the area between the iliac crest and the greater trochanter, we can establish our action zone. In this zone, we will have the gluteus medius and minimus. At this point, once the area is found, we can ask the patient to perform hip abduction, meaning to lift the leg. While resisting with one hand, we can palpate the contraction of the gluteus medius and minimus, because both of these muscles are abductors. At this stage, we ensure the patient is comfortable and use both fingers to locate the tense parts of these muscles. Once we find the tight area, which may correspond to the pain referred by the patient right at the moment of our palpation, we locate the tightest part that corresponds to the trigger point. Once we find the trigger point, as in this case, we ask the patient, is there radiation going down the leg? If the radiation is typical of the sciatica described by the patient, we can be fairly certain we have identified a trigger point for sciatica. We can choose to apply pressure on the trigger point in various ways, using our thumbs or fingers, and we maintain it for about 90 seconds or until we feel the muscle give under our fingers. After reducing the tension of the trigger point we found, we look for others, always in the gluteus medius and minimus group. The important thing is to stay in this area. Now we will look at the mobilizations of the sacroiliac joints in cases of sciatica. Naturally, we must first identify the sacroiliac joints. The sacroiliac joint connects the auricular surface of the sacrum with the ilium, as we know. We can find the sacroiliac joints by positioning ourselves internally to the posterior superior iliac spines. Next, we identify the posterior superior iliac spines as our reference point, which are these. At this moment, we perform this action. We position our thumbs right below the posterior superior iliac spines and move inward, doing this kind of action with our thumbs. We discover a softer, more flexible zone distinct from the posterior superior iliac spines because they are clearly bony. We go in and discover two indentations, which correspond exactly to the right and left sacroiliac joints. So, after identifying the sacroiliac area, we can execute the mobilizations. We know that this area is filled with ligaments. Mainly, we have the sacroiliac ligaments here. Therefore, it is a rather rigid or stable joint, one might say. We can then execute a mobilization to provide more mobility in this way. We position one hand over the sacral area, that is, on the sacral vertebrae, to make a fixed point. With the other hand, we set ourselves over the posterior superior iliac spine, which is the other reference point. In this manner, we position ourselves on both sides of the sacroiliac joint to carry out a joint action. So, with one hand on the sacrum and the other on the posterior superior iliac spine, we consistently align our body over the area to treat, and at this point, we push and simultaneously pull both hands away. So once more, we push while simultaneously moving both hands apart like this, always clearly on the side of the sciatic nerve, so on the same side as the patient's sciatic nerve. Thanks for watching our video about sciatica treatment. Remember to subscribe to the channel, like the video and leave your comments below. Make sure to also watch the video on how to treat piriformis syndrome with trigger point technique and the treatment of lumbago. You can access them by clicking on the side thumbnails. Furthermore, check the link in the description to explore our courses and further your knowledge and skills. See you in our next video.